I was quite inspired by getting some comments from my last video about healthcare not being a human right. So I appreciate the discussion there so far, and hopefully we can continue it. But as for today, I want to talk a bit about the healthcare system in Australia. I've talked about how there are Australians supporting Bernie Sanders, in the United States, and they're making phone calls to people, and I imagine they are making their case for a single-payer system or a more universal care type system. They can speak from experience on it because they actually have it. I'm sure that they repeat a lot of the talking points that Bernie Sanders has and make the pitch, make the sale. But I wonder how deeply they go into the details of healthcare in Australia. It's not a complex system, it's quite simple, and it seems to work for Australia. But I just wanted to give you some tips about it, provide a bit more information, and see what we can do with it. So, this first sheet here talks about where the money is spent. We have the 2019-2020 budget in Australia, and at the moment, healthcare spending is $81.8 billion for healthcare. It's a significant amount, but obviously, healthcare is an important part of any budget, and it's not cheap. And I think for most countries, the cost is only going up. So that's how much we're spending here, $81.8 billion. Once again, this is the Facebook page for the Bernie Sanders supporters in Australia, and they make the same case as usual. They believe that he's more in favor of the working class people in Australia. They believe, in America, they believe that he's going to take on the people who they see as being greedy, etc. And it's a bit of a shame. Because on one hand, they advocate that Bernie Sanders is the one who doesn't divide us based on our race, etc. But I would say he certainly divides us based on class because his class enemy, is those who sees as the rich. And his assumption for all of them is that they're only out to make a profit. And that's their only intention. And he has taken it upon himself to challenge those people and to take them on. So these people in Australia have gotten behind that message, and he's inspired many. So credit to him for his influence and the things that he has done. But the question is it the best way forward for the United States? In my opinion, as I've stated before, no. And I think a lot of his arguments for universal healthcare, for example, are those that often leave out details. They leave out all the information that I think is important for people to know about healthcare and what a universal type system will be like. So once again, for a bit of an overview, let's look at this here. So how many people in Australia actually have private health insurance? There's actually quite a robust sector for private health insurance, with both nonprofits and for-profit private health insurers. So at the moment, we have 13.5 million people in Australia, that's 54% of the population, who have health insurance, which is quite significant. So it's good in that sense because the public system isn't overly burdened. There's actually greater options for people who don't want to have the government system. They can choose to have better health care if their income allows for it, and that's a positive thing. But once again, not everyone is on the public system. About half of the population actually pay for it themselves through private health insurers. Hospital statistics here. Like the United States, Australia also has public and private hospitals. There are 693 in the 2017-2018 period public hospitals and 657 private hospitals. So there's still a bit of a mix of the two. And I just wanted to make a note about how much it costs to build hospitals in Australia. For example, the Royal Adelaide Hospital is on the top 10 or top 30 list for expensive buildings. The Royal Adelaide Hospital cost $2 billion to build, so it's quite expensive. And there are a number of reasons for that. But that's just a simple overview. It seems to work for Australia, and I'm sure all of you know that Donald Trump actually praised the Australian healthcare system to the then Prime Minister, Malcolm Turnbull. He said that you have better healthcare than we do. And in many cases, that is true because it is simple, it is straightforward, and it doesn't have an ingrained or an embedded industry like the United States does. It's new and it's fresh. And we have to keep in mind the difference in culture between the United States and Australia. Let's keep in mind, when you're looking at the differences between the people, Australia is a culture that after one massacre in Port Arthur in Tasmania, the government decided to remove all the guns from people. Now, I must say, the people were willing. Some were not willing, but others were willing. The main unwilling parties were those in the country who actually need their firearms. But that is the difference in the culture. Australians were willing to give up their arms after this tragedy. And I'd say in general, Australians tend to look to their government to sort their problems out for them. Many ask, what will the government do for me? And that is not the same in the United States. Can you imagine everyone in the United States giving up their guns to the government? It just will not happen. It will not happen. But in Australia, it did. So that gives you a sense and an idea about the culture of Australia, what the people are like. Now, I'm not making a judgment call on which one is better or not, but we have to keep these things in mind when we're talking about the differences in systems, the differences in culture. And that's the point that I make about finding a solution that suits the culture of the United States. Now, Bernie Sanders is going on about a system that does not fit the culture of the United States. And once again, I appeal to Republicans and those who have an alternative view to bring something forward that can quell the calls for the universal healthcare system that Bernie Sanders is proposing, because there are solutions out there that we can have and utilize to make things better. And it is far too simple to just say, oh, do what Australia is doing. It's far too simple to do that. And that's pretty much all that I have for today. I hope this has given you some insight into the Australian system, which I'm not criticizing, I'm just identifying the differences, but also adding that there is a robust private sector alongside the public sector. The private sector, it gives people more options and provides some alleviation to the government system that would be otherwise overburdened if it was to cater to the entire population. Let me know what you think, and I will talk to you soon. Bye-bye.